On January 7th, the Fresno Police Department received a 911 call regarding a possible overdose in the 900 block of North Van Ness. Our officers arrived and located 3 subjects in an apartment that were unconscious, passed out on the floor of the apartment. EMS was also summoned, and all 3 victims were transported to CRMC. One of those victims was pronounced deceased at the hospital, and 2 of the victims of the overdose were resuscitated and released from the hospital. In speaking with both of these subjects, we learned that the 3 folks that were in the apartment at the 900 block of North Van Ness bought what they thought was powder cocaine. They brought it back to the apartment. They got a razor blade. They cut it up into 3 lines. They ingested that cocaine, and then within about 2 minutes, all 3 of them began to feel symptoms of being lightheaded, dizzy, and then they passed out.
Less than 48 hours after the incident time, which conclusively demonstrated that fentanyl was indeed the drug involved in these cases, there was actually no cocaine detected. And so we believe that the quote-unquote cocaine that was snorted was in actuality fentanyl. Regular fentanyl is 50 times more potent than heroin, and certain fentanyl analogs, which we have also seen in other parts of the state and the country, are even more potent than that.
This is not just a law enforcement problem. This is a very serious public health issue. It started several years ago on the East Coast, and as we predicted, it worked its way across the nation, and now we are seeing it here on the West Coast.